Hi, my name is Judy Moreno. I'm an F&P student from Simmons College, and I will be narrating on how to do a pelvic exam and a breast exam. First, you have to introduce yourself to the patient and then explain the purpose of why you're doing the examination. Make sure the patient has emptied her bladder before the exam. You have to check all the materials and the equipment, including the sterile gloves, the lube, the speculum. You have to wash your hands inside the room with the patient, and you have to observe proper draping, only exposing the areas that you'll be examining. Um, Explain in advance each step of the examination and tell the patient that what she might feel. You have to avoid any unexpected or sudden movements. Always warn the patient when you will begin and make initial eye contact on a neutral area, such as the inner thigh or before beginning palpation or using the speculum. First is the external examination. You have to tell the patient that you are going to perform the external exam and explain why you're doing it. You have to inspect the labia, palpate the mons pubis, the labia majora, and the perineum. You have to separate the labia and inspect, looking for any ulceration, swelling, edema, erythema, nodules, or discharge, or even any smell. Look for the labia minora, the clitoris, the vaginal opening. You have to palpate the tissue between the thumb and the forefinger on the side. You have to note for any tenderness, swelling, discharge. Repeat the same procedure on the other side. And you also have to inspect the anus after that. Um, you it's also important to ask the patient and let her know that she can tell you to stop at any time. For the speculum examination, again, alert the patient that the speculum examination is about to begin. Insert the speculum. You have to hold the speculum at a 45-degree angle. Then open the labia with the opposite hand, and then introduce the speculum, pointing the tip of the speculum downwards to the coccyx. You have to insert it gently, slowly in the vagina along the posterior wall. You have to depress the perineal body and rotate it at full insertion so that the handle is vertical. And then open the speculum slowly, exposing the cervix. Then tighten the screw when you're satisfied with your view. So for the pap smear and other screen, you have to obtain cervical specimen by inserting a narrow speculum. Obtain endocervical specimen by inserting the cyto brush and rotating as indicated. You have to handle the specimen according to the correct procedure in your workplace. You have to hold the bills open and release the screw. Continue to hold the speculum until the blades are free from the cervix. Then allow the bills to close partially. Then allow the speculum to close completely as you take it out. But be sure to angle the speculum towards the posterior fornix as it is withdrawn in order to prevent hurting the patient by grazing the urethra. Now for the bimanual pelvic exam, you have to apply a lubrication on the index finger and the middle finger of your gloved hand. You have to alert the patient that you're doing the exam. Introduce the distal segment of the index and the middle fingers into the vagina. Use the pubococcygeal relaxation technique. You have to press down on the perineal body. Palpate the cervix and the cervical os next, and then assess for cervical motion, which you should not feel. There should be no motion. Tenderness, note for any tenderness by gently moving the cervix back and forth. And then palpate the uterine body between vaginal and abdominal hands, noting any uterine size and the position of the uterus. Move the vaginal fingers into the one side of the lateral fornix. Then place the abdominal hands and on the lower quadrant of the abdomen on the same side, and then attempt to palpate the ovary. And then do the same thing, ovary and mass, or if there's any mass. And then move the vaginal fingers into the other lateral fornix and repeat the same steps. For the bimanual rectovaginal exam, you have to re-glove, then alert the patient before before inserting before the exam, and then ask the patient to bear down as you insert the fingers into the rectum, because the anal sphincter relaxes when someone bears down. It helps. And then insert the finger into the rectum, and the index finger into the vagina, and then repeat the palpation and characterization of the cervix, the uterus, the ovaries from this posterior position. Then palpate the rectovaginal septum between the fingers in a scissor-like motion, and then offer the patient any tissue when you're done to wipe, and then help the patient assume sitting position. Ask the patient if there's any question. Tell the patient, reassure the patient, and then document your findings. And now we will check for the breast exam. To check for that, first, of course, you have to do the inspection for the breasts. You have to ask the patient to put her hands on her hips. You have to note the symmetry, the convex, the size, whether it's small, medium, or large. Normally, the skin is smooth. There should be no dimpling, no retractions, no masses, nodules, or lesions. And then for the inspection of the areola, you have to note for the size, the shape, and the location. Normally, it's a lateral to center. It's normally darker in tone compared to the breast tissue, and should be round and regular without any obvious lesion, cracking, or any fissuring. And then you have to inspect the nipple, and the nipple appearance. It's usually outward and slightly pointing downward. There should be no discharge unless patient is breastfeeding or anything like that. There should be no lesion, no fissuring or cracking. And after you do the inspection, you will have to palpate. For the palpation, you have to ask the patient to lay down and put her hands behind her head, whichever side of the breast you are examining. You have to begin by palpating the breast tail or the tail of Spence, usually in this side, and then using the pads of your fingers, you have to make a concentric circles around the breast tissue, noting for any masses or any lesions or tenderness, dimpling, or deformity. And then you have to palpate the areola. Usually areola are soft, it's regular, there's no obvious masses or lesion. And the nipple usually feels elastic, and you should not be able to express any discharge. There should be no fissuring or any tenderness. Also, with palpation, you have to check for the axillary nodes. First, you have to check for the axillary nodes, the central, but you have to use your opposite hand, and then go from the axillary tissue, and then the lateral, which is this one, and the posterior, anterior, this is central, and you have to note for any tenderness. Usually the axillary nodes are non-palpable and non-tender. And that concludes the exam for the breasts. Thank you.